kidney transplant in Nigeria versus kidney transplant in India. Which one is actually the best for you? Okay, in order to discuss this topic, I would like to bring a lot of things to our knowledge. When considering any place you want to access your medical care, there are things that are primary for you to actually look at. One is affordability of the care. Okay, someone can have 1 million naira and will be able to access care and get solution because of the information they have, and some may have 500 million naira and will be looking for where to get solution. So it is very important that you have proper knowledge, so that when you have issues like this, maybe need for kidney transplant, you actually be well informed to know where to choose, so that you actually maximize everything that has to do with the treatment you're actually looking at for. So you're looking at transplant in Nigeria, kidney transplant in Nigeria versus kidney transplant in India. So now we're looking at expertise. Okay, over the years, Nigerians have actually grown their expertise in kidney transplants. I can actually close my eyes and mention 10 Nigerian hospitals that can actually do kidney transplants perfectly. In fact, they've done it over the years and they have track records. So we have this. So we have a lot of expertise that can actually do it. Then after that expertise, you now talk about another thing that you need to consider is the success rate of the center where you're going to be doing the procedure. So success rate means how many persons have they done in this particular center that have actually lived, that are actually living or have lived for a very long time. So we have centers in Nigeria that we can actually beat your chest and say that we have seen people who did transplant in these centers and they're actually okay. Aside success rate, it's actually very important for us to look at another very important part of this thing, which is follow-up care. So after doing kidney transplant in a center, there's actually need for follow-up. So follow-up can range from weeks, months, or even years. So if you're if you're Nigerian getting your kidney transplant in India, you also have to check how heavy your pocket is. You have to check how financially stable you are. Will you be able to afford flight tickets to and fro, and for that of yourself and that of your caregiver, or maybe your relative that will be going with you? Will you be able to afford these people's transportation, air flights, through and fro, coming back? Then if there's need for you to go back there 2 times or 3 times in a year for follow-up, will you be able to do that? I know we have a lot of things we do maybe telemedicine these days, but the truth is that most of the time it's actually very important for you to be present in the hospital. So having discussed this, when emergency happens, where do you run to? So if you did your transplant in India, where are you going to run to if there's need for you, if there's an emergency? So you discover that most of the time it's actually better we get ourselves treated in this part of the world, in Nigeria, so that the hospital or the center can actually be assessed during emergency. Because some things may happen, and there is something that happened intra procedure that before anything will be done in that case of emergency, the surgeon or the facility that did that surgery need to be called to know what they did and how to be able to handle that situation. It happens in some cases. So these are the things that you actually look into while doing your making inquiries for where to do kidney transplant for your loved ones or for yourself. Then of course that another thing you have to do is post-transplant drugs. So a lot of people will be needing post-transplant drugs after the whole thing. So if you're doing the post-transplant drug and your supplier is in India, what if something like COVID happens? Okay, so it's better you have someone close by where you can actually run to. Maybe we would have stocked it over the years, and it will be of help. Okay, my name is Honorable Victor, and I'm your kidney health coach. If you've learned something from this video, I want you to do me well to share, and also